Welcome to the Nuance Podcast, where we engage expert guests in deep discussions about health. I'm your host, Amanda. We aim to reclaim the nuance often lost in today's conversations, exploring topics like social determinants of health and their impact on individual and community well-being. Ultimately, we believe that a healthier Earth community is only possible when everyone thrives, and we strive to foster a more equitable future through our discussions. In today's conversation, we speak with Dr. David Eisenman, MD, MSHS, who is a professor at the David Geffen School of Medicine at UCLA and has a joint appointment at the UCLA Fielding School of Public Health, where he directs the Center for Public Health and Disasters and is the Deputy Director for Community Partnerships at the UCLA Center for Healthy Climate Solutions. Dr. Eisenman is also an Associate Natural Scientist at RAND. Dr. Eisenman lives and surfs in Marina del Rey, California. In this conversation, Dr. Eisenman explains the health effects of wildfire smoke and how far-reaching the effects are. It surprised me how communities can be impacted even if they are far distances from the actual fire. He explains the inequities and how people experience health effects from this wildfire smoke. There is more and more discussion about the changing climate and the intersection with mental health. We discuss how wildfire smoke can impact mental health of the people affected. Even if you don't think you are directly living somewhere that will be affected by wildfire or wildfire smoke, this conversation is relevant to most of us. The impacts of fires are far-reaching, and they are increasing in severity and frequency. This was a really interesting conversation, and we hope you enjoy it. Now, on to the podcast. Hi, Dr. Eisenman. Welcome to the podcast. I'm very, very excited to chat with you. We've been in contact for a while, so I'm excited to make this happen. And you're doing awesome work, so happy to hear more about it.
Oh, it's really a pleasure. And I'm so impressed that you're doing your residency, as I was saying to you before. You know, your generation of physicians, the fact that you've taken this up and you're taking this up during your residency is one of my sources of optimism.
Thank you so much. That means a lot. So I would love to just jump into it. We've recorded your bio in the back end in the editing process, but I think that there's a lot that we miss when we record bios. So can you just give a little brief introduction of who you are and what kind of work you do?
Right. So I'm a professor at UCLA in the School of Medicine, and I'm an internal medicine doctor. I'm board certified. I see patients one day a week, which is one day of my one afternoon of my faculty practice, and one morning precepting the residents. The rest of the time I do research on disasters. And I've been doing research on disasters for 25 years now. I got interested in that after 9/11 when, and I'm not sure if you asked that question, how did I get into it? But it's an interesting story. How did a doctor get involved in disaster research? So, when I was a young physician, we'd started a program at Bellevue Hospital in New York City for survivors of torture. These were immigrants and refugees who'd been tortured in their country and were now living in the United States. And, what it was learning about political violence and how it affects individuals. But then because we also saw whole communities over time, and we saw, dozens and dozens of people, for instance, from the Tibetan community over time, you got a sense of what political violence did to communities. And then when 9/11 happened, I'd already moved to Los Angeles, but it hadn't been that long that I was here. And I felt like I knew something about political violence and the primary care doctor's role in it. Now, there were really no models or frameworks to understand the physician's role in disaster research, apart from just being on sort of the front lines and delivering care in a field setting, for instance. What can a researcher do? And so it turns out that there was this whole field, unbeknownst to me, of disaster research. And most of the researchers were sociologists, in the social sciences. They were sociologists. And I found a lot of frameworks and theories that were really akin to what I was learning in my health services research training. And so I started to become interested in disasters. And, over time, of course, in the last 10 years, climate change has really been the focus. So I've been doing this disaster research turned into climate change research since, 2000, really.
There are so many disasters that we could touch upon. I went to medical school in Tulane, so hurricane disasters have been near and dear to my experience. But specifically today, we'll be focusing on wildfire smoke. So what are the dangers of smoke exposure from wildfires?
Well, so smoke includes lots of different elements and ozone, chemicals, all kinds of things in the wildfire smoke, one of which is what's something called particulate matter 2.5, which are these small particles. They're 2.5 microns in diameter, and they're kind of a solid and liquid together. And they're really smaller than a grain of pollen. And they can penetrate deep into our lungs. And actually, they even cross the blood-brain barrier, which is the barrier that keeps constituents in our blood from getting into our brain. And so these particles can go anywhere in the body, and they cause a toxic inflammatory effect to the organs they hit, including when they cross the blood-brain barrier, the brain. So wildfires, now we know, are increasing in all kinds of parameters. The season where wildfires are occurring is longer. It stretches later into the year. The wildfires themselves are more frequent. They're larger. They last longer, sometimes, weeks or months even in duration. And we're now even seeing these, as a result, these kind of chronic, multi-week wildfires that are just spewing out wildfire smoke. And smoke can travel hundreds and thousands of miles from their origin. Now, anyone on the East Coast will remember this because last summer, smoke from the West Coast was reaching into New York, and we had all these photos for orange skies in Manhattan. There was a study that looked at, let's not skip ahead, but just to say that, we're having these wildfires that are producing smoke for months on end, and that's months on end, for weeks on end, can certainly travel very far.
Yeah, absolutely. The severity and frequency of wildfires is scary. And so for everyone listening and who may be exposed to this smoke exposure, what are some of the health effects that people can experience from the PM 2.5 and all of the other things that are found in smoke exposure? Because, right, your house burns, and then that can also release some chemicals.
So you would normally think of smoke as causing respiratory problems. And of course, we well researched to show that wildfire smoke increases your risk for asthma attacks, increases the risk of pneumonia, increases hospitalizations for other respiratory problems. Interestingly, over the last few years, we've seen more research showing the effects on other organs. So in the elderly, for instance, there are studies showing increases in angina, increases in heart attacks, that it worsens heart failure, that it can precipitate abnormal heart rhythms, arrhythmias, precipitate blood clots in the lungs and strokes. And we actually see evidence of this really far away from the wildfire. So there was a study of wildfires coming out of Quebec province in Canada, and they looked at hospitalizations down on the eastern seaboard of the United States. So Baltimore, that area. And it found increases in hospitalizations in Medicare patients, so older adults, linked to the wildfire smoke from this fire, 1,000 kilometers away. So it's really potent in many ways. Maybe at some point we can also talk about the mental health effects. There's very clearly neurological effects also, though. I just want to point out another interesting study that was sent to me recently was a study on Alzheimer's. And in that study from the Alzheimer's Association, really alarming findings, they found that the chances of getting a diagnosis of Alzheimer's dementia increased with exposure to PM 2.5 for everyone, regardless of the source of the PM 2.5. So PM 2.5 is a constituent of air pollution. It's a marker of air pollution, whether it's from cars and trucks and industry or from wildfire smoke. But this PM 2.5 caused more increases in dementia, Alzheimer's dementia, when the source of it was wildfires. And it caused increases in Alzheimer's dementia at lower doses of PM 2.5 when it was from wildfire smoke. So, the uptake is that this PM 2.5 from wildfire smoke is probably more toxic to the brain than PM 2.5s from air pollution. And, if you think about what burns in people's homes, people keep their paint in their home and their electronics in their homes, and which has all kinds of lead and other chemicals, cadmium, chromium. People have all kinds of flame retardants on their furniture that once they burn up, though, emit horribly toxic chemicals. So all of that is in the PM 2.5 from wildfire smoke that seems to be more toxic than the PM 2.5 from industry.
Oh, very, very interesting. So in your article, It's the Smoke, you mentioned that media and the public perception of wildfires is an affliction of the rich. So what are some of the inequities in wildfire smoke exposure? You did mention Medicare patients specifically in one of those studies, and then regionally, demographically, and economically.
Yeah, so I said that because what really bothered me at the time of my writing that article was watching the national news about wildfires in somewhere in the West, California or Northwest. And it showed these pictures of big, clearly like second homes, meant to be second homes in the mountains. And it just was transmitting the image that this is an affliction of somebody who has a second home in the mountains, aka the rich. And, not getting a whole lot of sympathy like you might see with a flood or an earthquake where you show, people are on the street. You can't tell their SES level. I think that's really a mistake because while the fire might be burning those particular homes down, the smoke does not discriminate in where it goes in that regard. And there's every reason to believe that there will be more health disparities demonstrated from the damage from smoke. So let me back up a second. In all of disaster research, we have sort of three pillars of looking at a vulnerability. We look at the exposure, how much you are exposed to. We look at your ability to protect yourself from that exposure. And then we look at your individual or community level sensitivity to that. And what we know in disasters is that there are inequities across all three of those. The wealthier, for instance, are less likely to be exposed to all kinds of disasters. They're more able to protect themselves. And because of higher amounts of money and better health, they're less sensitive when it comes around. Similarly to wildfire smoke, who is more exposed? Well, outdoor workers, low-wage workers, migrant workers, for instance. And then who is going to be able to protect themselves? Well, for instance, the best are going to be people who can temporarily evacuate. And, I'll tell you little stories. Back in the August 2020 fires in Northern California, in Central California, down here in Los Angeles, we were getting all that smoke. And by September, it had gotten really bad. And I took my family and we left Los Angeles and we went east away from the smoke out to Palm Springs, and I was able to work temporarily, work virtually from Palm Springs. Now, that's completely because my privilege as a physician allowed me to do that. I could go in my car and rent a second house somewhere and get away. And that ability to temporarily evacuate is completely, a question of privilege and inequity. So, and the last part of that is the sensitive conditions. So we know that lower income communities, for instance, have higher levels of medical comorbidities like baseline rates of asthma. They have less access to healthcare in the first place, lower rates of high quality care, or higher rates of heart disease and so on. So they're really going to be more sensitive to the effects of smoke. And so you look at all three of that, and the smoke is really going to cut across it. And while, yes, if your home is up in the mountains right next to it, you're going to get a higher dose of smoke, you're, one, probably going to be able to move away. And it's the people who can't move away who are really going to be affected. So I'm really concerned about the inequities that smoke will demonstrate having on people's health.
Yeah. And then another group of folks that I've been working with recently are unhoused people. And obviously they cannot escape from the smoke exposure.
Yeah. And there's a double inequity that's occurring with smoke exposure too, which is that more and more it's coming with high heat. I'm thinking of people who are stuck in an older home who don't have air conditioning, and it's hot outside and smoky outside. And what do? Do they open their windows and cool off the house? But then it lets the smoke in. So the inequity of the distribution of air conditioning is a big issue in California. And so I think that's another issue here.
Absolutely. And we don't just see that with the wildfire smoke too. It's just in general, when it's hotter out, the air pollution just increases because it becomes so stagnant. So pretty much anytime it's hot, the air quality is not great for those folks, which is what, like you said, a double-edged sword. So in California, what are some preventative measures that we're taking to reduce these inequities caused by wildfires?
I would say we're not doing enough. There have been small efforts at times to deal with it. During those same 2020 wildfires that really scared a lot of Californians considerably, up in the Bay Area, there were some programs, what's called the Air Quality Management District. California has many of those across the state that are jurisdictions doing what the name sounds like, regulating air quality. The Bay Area Air Quality Management District handed out portable air filtration units to low-income individuals on Medi-Cal. With those who had severe asthma or other respiratory conditions and were low income on Medi-Cal were eligible for these portable air filtration units. So, a very circumscribed group of people, very needy, but still a very circumscribed group of people who are eligible for this program in a very, populated, but one district of California. I'm not seeing a lot of public health programs rolling out yet, statewide or locally, or, from public health or from the medical centers for that matter, which is a real missed opportunity. There was a study from my colleagues, Rachel Connolly and Michael Jarrett, that looked at the annual rate of deaths from smoke in California. And their study showed that the annual range of deaths was anywhere between 1,100 a year excess deaths and 11,000 excess deaths a year from wildfire smoke. So at an estimated economic burden of $100 billion or more on some years in California. So an important number of people are dying from wildfire smoke each year in California, equal to, if not exceeding, the number of people who are dying from extreme heat I'll say. And it's a huge economic issue for us. And it's just not being dealt with by our medical establishment or public health establishment in a large, visible way.
Yeah, and I wonder if too the range is so large, like 1,100 to 11,000 extra deaths and extra medical costs, because as physicians, I know that at UCLA it's a little bit more prevalent and people talk about it more, but where I trained before, people were not linking environmental exposures to deaths or to increased morbidity. And so a lot of times, like I read something about heat, like excess heat deaths, and it can exacerbate heart failures, like what you're saying, heart failures, heart attacks, all of that. And then in our ICD-10 codes or whatever on the death certificate, it's like from a heart attack instead of from heat or from wildfire smoke. So I wonder if there's even more exposure and more deaths that we're just not attributing to those environmental exposures because it presents as something else.
Yes, that's the case in all disasters. There's a growing literature in disasters of analyses on statistically calculated excess deaths. So this is the case in hurricanes, wildfires, heat, that you have these number of deaths that are based on death certificates, which are well known. Anyone who's filled them out knows how inadequate they are. I mean, I was a resident once and asked to come down and fill out the death certificate, albeit this is a long time ago. And, I did my best to figure out the primary and secondary reason, and then I kind of guessed the third reason and didn't really think about the policy importance of my really considering this. So you can tell me if that has changed very much. I mean, do you get much education on filling out death certificates?
We're trying to do more. And then also, when you're filling them out, it also depends on what kind of education you got. And we don't get a lot of education about environmental exposures too.
Yeah, I mean, one of the things that we could be doing as attendings and as residents is really having some lectures about death certificates and thinking about how filling them out has policy importance, at least in this example. So, but anyway, yes, there's all the statistical analysis showing a lot more excess deaths from hurricanes, from wildfire smoke, from heat, and it's inevitably 10 times the amount that's reported, for instance, in the press, is in the publication that comes out 6 months later, it's 10 times more, and that doesn't necessarily make the press.
So we did touch upon what California is doing, and not enough, to prevent these inequities caused by wildfires. Are there any interventions that we can learn from across the country or even globally where you are looking at their examples and are like, this could be something that would benefit our population?
Well, there's a couple things that strike my fancy. One is something a colleague of mine at UCSD is leading, Tariq Ben-Marnia, which is using an electronic medical record up at UC San Francisco to start to understand who is at risk of hospitalization and rehospitalization from wildfire smoke. So you can imagine, again, as a resident, that when you're discharging a patient, if they've been hospitalized several times in a month, I don't remember what it is because I'm not an inpatient attendant anymore, they're considered high risk. And they get for a different level, a more intense level of discharge planning, so they don't get admitted again in the next 6 weeks. Well, what if you could sort of do that sort of high risk identification for people who are admitted for wildfire smoke or for extreme heat? And then you might start doing some home evaluation, some social drivers evaluation, some education, some connecting to social services. So when the next event happens, they don't get hospitalized again. So using the electronic medical record to flag and then intervene with high-risk patients. And also, by the way, you could start to even think about using it to message those patients. It might be simply sending them a message when PM 2.5 in the air hits above, a certain value. You send them a message in their My Chart saying, it's a bad air day. Do you have enough albuterol? If you need a refill, let us know. So I think that's got real possibility. We need to be doing more of that in the University of California. There is this idea out there. I haven't really seen a lot of it being operationalized, which is to have smoke-ready communities. So it's the idea of taking communities. We have communities that have focused on wildfire flames. They're called different things, but wildfire-ready communities, I think, often called that. And they're very focused on protecting homes, hardening homes up in the mountains, in the forests, from burning, so that people cut their trees back a certain distance from their home. They put on fire-resistant rooftops. They trim the bushes around their house. They make it so that their house is less likely to burn in a fire. They plan to evacuate. They have all kinds of plans around how to prepare and respond so their home doesn't burn. Well, what if you did the same thing for communities that are getting a lot of smoke? Up in Northern California, for instance, where there's a lot of fires, those communities are having disproportionately high rates of these days of bad smoke days from wildfire. Not getting fires. They don't have to. They are getting fires, but when they're not getting fires and they don't have to evacuate, they're still getting the smoke. And what can those communities do to help people make their houses more sealed from the smoke, provide a place for them to go if they're getting too much smoke in their house, kind of a clean air space, provide them with the right materials and filtration systems in their HVAC system, all kinds of things you could do to make a smoke-ready community.
I like that idea. That's very cool. How would someone know if the air quality is poor from smoke? Because, when it's really bad, it's obvious because then the sun is like orange in the sky. But how can someone know if the air they're breathing is safe?
There's something called airnow.gov, and on a lot of it is the air quality management. It's the air quality index. It uses something called the air quality index, the AQI, and the AQI appears, for instance, on a lot of apps in your phone. It's integrated, for instance, in iOS weather app, and it's a good idea to actually pay attention to it. Really, so it goes from 0 to 500. And a good air day is any day from 0 to 50. That's a day when, you don't have to worry about the air quality, and it's great to be active outdoors. When it gets from 51 to 100, that's when people who are more sensitive, such as asthmatics, should consider really being outside for shorter periods and doing less intense activities. Like if you're somebody who has asthma and the air quality is between 51 and 100, that's not a good day to do your outdoor run. From 101 to 150, that's a day when it's really unhealthy for really almost everybody, I would say. They'll say it's unhealthy for sensitive groups. I would say that if it's 100 or higher, it's unhealthy to breathe. And those are days when it's 100 or higher, I don't go running. I don't have any medical problems, but I don't go outside and run. I try to actually limit my time outdoors. I close the windows in my home. I don't have enough of a medical problems to worry about this, but I would say if somebody did have them, I would recommend wearing an N95 mask when they have to go outside. I think anything above 100 is really unhealthy to breathe. They'll say that anything above 150 is when everyone should consider avoiding long outdoor activities. I'm a little more conservative because I think that there's probably a lot of measurement problems in these systems, and I'm a little bit skeptical about them.
Thank you for that. So, in addition to some of the physical health impacts that you chatted about in the beginning of our conversation, there are also now mental health effects that we've noticed from the exposure to smoke. So can you talk to us about what we know so far about the effects of wildfire smoke on our mental health? And also, in some of your articles, you mention solastalgia, if I'm pronouncing that right.
Yes.
And can you define that, please?
Yes. Well, in order to get to the solastalgia part, let me start from we start with a little story here. It was the summer of 2020. It was the pandemic summer, and it was the summer saw us coming out of our shells. We were coming outside more. We were feeling a little bit of freedom from the pandemic lockdowns. I don't remember the details, but it felt a little bit like we could liberate in some ways and socialize a little more. And by September, though, the wildfires up in California had come down to Southern California, and I was locked back in my house. What had been winter and spring of feeling isolated and scared to go outside because you didn't know how it would harm you to go outside from COVID-19 was now once again a feeling of we can't go outside because of the wildfire smoke, and we're isolated from socializing from the wildfire smoke. And everything that I enjoy and that brings me spiritual solace, like nature and going into the mountains and going to the beach, I can't do because of the smoke. So this got me really interested in research on the mental health effects of wildfire smoke. I mean, a lot of our research is me search first. And how is it happening that I'm feeling sadder and more depressed with all this wildfire smoke around us? And when we did a large literature review, and we found really a growing body of evidence looking and seeing the multiple ways that wildfire smoke can harm mental health. So there are now a couple studies that actually have fairly definitively shown mental health effects from wildfire smoke, looking at, for instance, increases in sedative hypnotic use and prescriptions during wildfire events miles away, so related to smoke patterns, looking at, sort of the correlation between smoke and those prescriptions. A recent study looking at adolescents and their effects, PM 2.5 effects on depression and anxiety. But it's also interesting to think about how does wildfire smoke cause mental health problems? So there's probably a few pathways. There's probably, first of all, a biological pathway. And we have talked about how these toxins get into our brain and can do damage through the direct toxic effects. There are probably some somewhat mediated effects where, like, for instance, smoke makes it harder for us to sleep, whether that's both biological as well as just purely physical, like the smoke is making it difficult for us to sleep, so it's bothering us in our sleep. It has physical and biological effects. It also has social and emotional effects. And that's where solastalgia comes in. When you're locked in your house, you can't go outdoors, you can't enjoy nature in the northern parts of the United States where summer is a short, brief time. You can't enjoy your summer suddenly. You've really been disconnected from your community and from nature. And so then there's this concept of solastalgia. And Glenn Albrecht was, maybe he is, I don't know if he's still alive, a philosopher, Australian philosopher, who coined this term. And solastalgia means loss of solace. And it means it's the feeling of emotional, mental, and spiritual distress that occurs at the degradation of one's valued environment. And he used it to describe those impacts experienced from environmental change, which at that time he wasn't calling climate change, but now, it's a transportable model in that way. So, I think he very nicely described it as sort of the loss of solace because of the loss of connection to the environment. Or he also called it the homesickness you have at home, which I think is helpful to understand it. So a lot of what I was experiencing there was solastalgia. I couldn't go outdoors and be in the mountains. And in the studies that looked at wildfire smoke, that was one of the pathways. They described this community up in, I believe it was Washington State or Canada, that had 40 days of chronic smoke exposure. And they called it their lost summer, when the attachment to the land and the place, they could not have it. They felt alienated from it. And it took a deep emotional, if not spiritual, toll on them to lose that connection to the land and place. So again, another one of the pathways that wildfire smoke might be having towards impaired mental health.
I'm from Washington State originally, and the love and solace and spirituality we find in nature is unparalleled. And so having 40 days of unable to enjoy your summer would be very, very difficult, I think, for everyone's mental health.
Yes, I think that this concept of solastalgia, we did a study of a wildfire in Arizona and looking at the effects on the 5 communities that surrounded the wildfire. And when I went to start this, I was going to do a survey of all the 5 communities. I was going to do it 6 months after the fire. And when I went to visit them directly after the fire and just talk to people, I kept hearing the same thing, which is people saying, I'm grieving for the loss of the landscape. They all were surrounding this national forest that had burned down. And they had moved there very intentionally, or were staying there very intentionally, because they got a lot out of living next to or inside that forest. And that grieving statement, it struck me as a clinician like I hear in my office when somebody's lost a family member or a partner. They're in grief. And I started looking for concepts that would capture that grief at the loss of the landscape. And that's when I happened onto Glenn Albrecht's concept of solastalgia. So I really heard it in these people's voices. Anyway, we made a scale to measure solastalgia from the wildfire. And in multivariate analyses, so the controlling for age and other SGS factors, we found that solastalgia was as associated with poor mental health 6 months after the wildfire, as was an adverse financial impact of the wildfire on one's home. So that's a really strong effect. And I think solastalgia, while it's not a mental illness itself, it's kind of the pathway for some people or kind of mediator of how their mental health might be impaired.
I think it would be very important for folks to reflect on this, because it's not just smoke exposure, but having trained in the South, people are losing their homes. They have to move from flooding, from hurricanes. And so I think it's seen everywhere. And I don't know if there's a lot of places that are really protected from all of these environmental disasters. So mental health is, we see it on the rise, mental health effects. So I just think that if we reflect on where some of these like depression symptoms, anxiety symptoms are coming from, we can be a little bit more inspired to protect our environment.
Agree wholeheartedly. It's part of what you mean by planetary health, is getting beyond this idea of climate change as the only problem in how our relationship to the planet affects our health. It's one great stressor, but we're going to lose and are losing environments from degradations from other sources. And this is, solastalgia is really a potent pathway for connecting people to, maybe not saying it out loud, but in our concepts of planetary health, I think it's a potent mediator.
Yeah, I agree. Thank you for talking about that. I think that's very important. And then I do want to ask you, because on this podcast, we've talked a lot about the impacts of environmental degradation and climate change. And something I've grappled with is, yes, we can tell our patients that they're at higher risk for, Alzheimer's asthma exacerbations, angina, heart attacks. But how do you talk to your patients about these effects? Or are you mostly like focused on policy and research and all of that? Like, how do we communicate this with patients?
I do communicate this with patients. Yeah, I mean, there's not a lot of time, obviously, in a clinical visit to get into it. I do certain things that are very focused that they will help, that helps them right away. I do ask patients who have a lot of medications to make sure they have an extra go bag full of their medications, or to make sure they have at least 2 weeks of extra medications at all times in case they need to evacuate for whatever reason. And I think there are ways that we can help our patients get that. Some insurance plans have a disaster preparation allowance for you to get an early refill. Other plans allow you to get it based on having a vacation override or a lost medication override. Or I just encourage patients to get mail order and get 90-day supplies at a time, and to refill maybe early once so that they have a little bit of a stock. So if I use that, I think that's one of the main things I do as a physician, is make sure people have medications and think of it as part of their disaster preparedness. And that's easily accepted here in Southern California, where people have been learning about earthquake preparedness for generations. Mm-hmm. I mean, I think if you want to talk about how do we talk to patients about climate change, they do ask me about it. And I say a couple things. One is I say that the most important thing they can do is vote. That their voting and voting on climate change, if it's really important to you, voting on that as the decisive issue in your choice of candidates is the strongest thing you can do. Go green, do all sorts of other things, yes. But if you want, for my dollar is the greatest bang for the buck, I would say.
Yes. Thank you so much for mentioning that. And then lastly, we ask all of our guests to finish the following sentence. The future is blank.
Finish the sentence. This might be a little bit long. I'm going to finish it with an idea. The future is we are stuck with climate change. We've seen that. We now know it. We have committed ourselves to, and our descendants, to some qualitatively different world than what humanity has grown up on. This, I don't think of this as pessimism. I think of this as realism. But I don't think we're doomed either. I think if we are lucky and thoughtful and intentional, there might be good times ahead. I mean, we had a 20th century where 230 million people died of war and famine. Yet we had, advances in arts and culture and prosperity and freedom, around the world. So I think if we're, lucky and intentional, which are very capacious terms, this won't be worse for humanity necessarily than other things we have survived. And so, Aristotle said, a valuable life is one that is devoted to valuable activities. And I think, one valuable activity is trying to make the world better through any kind of climate change related action. So that's the future.
I love that. Thank you so much. That's very realistic, but hopeful. So I really appreciate it. Dr. Eisenman, thank you so much for spending time with us today. And thank you for all the work that you do. It's very, very important for physicians to be working on these types of issues. I mean, climate change is a very, very pressing public health issue. So I really appreciate it. Thank you.
It's a pleasure. I'm so glad that you're doing this. I could never imagine having a podcast when I was a resident. All I wanted was sleep.
Well, both. Both and.
Okay.
Right. Thank you so much.